Lens on some of the health disparities women of color face. This morning, we're looking at fibroids and how one doctor is working to provide more options for women suffering from them. Janai is back with more on this story for us. Good morning again, Janai.
Hey, Robin. Yeah, studies show that black women are 3 times more likely to develop fibroids compared to white women. And for those suffering with fibroids, it can impact so many aspects of a woman's life. But the good news is there's not only something that can be done about it, but there are also options.
For years, Dacre Robinson says life revolved around managing her fibroid symptoms.
It's a lot of anxiety, to be honest, to just not know when your cycle's going to come and know it's going to be a problem if it comes unexpectedly.
Fibroids are benign, usually asymptomatic tumors that grow in the uterus. And while an estimated 70 to 80% of women will develop fibroids by age 50, studies show black women are more likely to experience severe symptoms like heavy bleeding, anemia, pelvic pain, and abdominal bloating. And evidence in a study in North Carolina shows black women were treated with hysterectomies at higher rates than white women, and often during their childbearing years.
It's so widespread and there's not enough known about it. We're missing the impact that we could have on this very, very large population.
For Dr. Soyini Hawkins, it's personal.
My fibroid journey was quick, short. It was very, very, very miserable.
How did your experience with fibroids and the treatment end up influencing what you do today?
Because I was later in my diagnosis and my uterus was so large, I didn't have the options of minimally invasive surgery.
From patient to practitioner, today Dr. Hawkins is a minimally invasive gynecologic surgeon offering alternative treatments and hope for women like Dacre.
What would you say to a woman who has fibroids and is deciding what to do? How would you encourage her to be her own advocate?
I would encourage her to first listen to her body, take heed to the changes, and speak up. And then take all of that knowledge to your doctor and say, what can I do?
And Dr. Hawkins encourages women not to suffer in silence, but to advocate for themselves and speak up. So she says, push to get a diagnosis and then push to learn the options available and what can be done. Robin?
Oh, great. Janai, thank you so much. And so we're going to bring in Dr. Jen Ashton. She's going to break it all down for us. And you hear that all the time. Go to your doctor, ask the questions. What questions should a woman ask her doctor about this condition?
Robin, the 2 most important questions are size and location. Not every fibroid needs treatment. Not every fibroid causes a problem. The location is really important. Are they outside the muscle, inside the muscle of the uterus, or inside the cavity, which typically causes very heavy bleeding? And how big they are. You have some fruits in front of you, Robin. They can range from the size of a grape all the way up to the size of a grapefruit. So again, both of those things very important, size and location.
Well, we can see that. It's so visual to see how different it can be in size. So what are the available treatments, Jen?
Robin, the most important thing, there are more options today than ever before. And if you take a look at this list, they can range from temporary hormonal treatment all the way to surgery done via the cervix, same-day procedure, laparoscopic, minimally invasive, radiofrequency, also uterine artery embolization, which is done by interventional radiologists. So when women go for their treatment options, they need to ask about all options, not just the one that surgeon can do himself or herself.
And Jen, I got to give you credit again. You came to me a few weeks ago and said it's so important to do reports like this. Why did you feel that way?
Because, Robin, you know, after being in practice 16 years, I've seen the effects of race and ethnicity on women's lives, and it's not a one-size-fits-all approach. And really, the kudos goes to you and ABC and Janai and the brave women who share their stories. So the more we can increase awareness, the better care these women will get, and the better their quality of life will be.
Thank you for being the catalyst for this. Appreciate that. We'll have more reports in the days and weeks ahead.